Hello everyone, this is Dr. Sarachandra, Consultant Surgical Oncologist at Fortis Hospitals, Bangalore. So a few basic questions and answers about cancer in general. First of all, what is cancer? Cancer is a disease in which some of our body cells attain a capacity to multiply in an uncontrolled fashion and they spread to other parts of the body. What actually causes cancer? Cancer is caused by smoking, alcohol consumption, unhealthy lifestyle habits, unhealthy dietary habits, lack of physical activity, having excessive body mass index, and rarely due to genetic predisposition in less than 5% of the cases. So how do we recognize cancer? What are the symptoms of cancer? Variety of symptoms like loss of appetite, loss of weight, development of a mass or a lump or an ulcer anywhere in the body which does not respond to the primary treatment could be symptoms of cancer. Many times cancers don't present with specific symptoms. Like for example, they can present with anything like headache or a relentless cough or pain abdomen or any other symptoms like altered bladder and bowel habits. For that matter, to summarize the symptoms of cancer, I would suggest that any patient who undergoes the basic primary treatment for any of the symptoms in the body with his primary physician, after taking the course of basic treatment for 1 week or 2 weeks, if the symptoms don't regress, that means persistent symptoms, or even if they regress, if they are going to come back in the same fashion in a few days, that is recurrent symptoms, that meaning persistent symptoms or recurring symptoms in spite of basic primary treatment by the treating physicians, we should go one step further and see if there is any underlying serious cause which is responsible for this persistent or recurrent symptoms. So how is cancer diagnosed? Cancer is diagnosed by because cancer is a disease of the cells, it is also diagnosed by taking a biopsy from the tumor tissue, examining it under the microscope. Cancer is always diagnosed under the microscope, and it is basically from the tissue specimen obtained on biopsy from the tumor tissue. Or sometimes in case of blood cancers, it is by means of a blood test or a bone marrow test. Once cancer is diagnosed under the microscope, it is properly staged by using various investigations that are available. Once the stage of cancer is ascertained, then the treatment is planned. What are the broad modalities of treating cancer that are available to us nowadays? Surgery. Surgical oncology is a field which employs surgery to treat cancers. Surgeries, as we know, involve mechanical removal of the tumors. So wherever applicable, minimally invasive surgeries like laparoscopic surgeries and robotic assisted surgeries, they offer the advantage of doing surgeries with greater precision, providing quicker recovery for the patient postoperatively and also less postoperative pain and quicker recovery to the work. Medical oncology is a field which employs usage of drugs either in intravenous form, in the form of chemotherapy, or oral drugs, so to treat cancers. The concept of precision oncology is coming up. Cancer is nowadays understood as a diverse group of diseases which are driven by various molecular and genetic abnormalities. Precision oncology is the field which tries to target specific targets based on each individual patient's genetic makeup, so that we attain better results with cancer treatment and even at lesser toxicity levels. So that is what is precision oncology. The third field for treating cancer is radiation oncology, which employs high energy X-rays for treating cancer cells. So these are the broad modalities of treating cancer: surgical oncology, medical oncology, and radiation oncology. For most of the solid organ cancers, it is a multimodality treatment wherein more than one modality of treatment is employed, and the sequence of treatments is decided by the treating physician. So these are the three modalities of treating cancer. Now, how do we circumvent in the present day scenario? The incidence, all of us know the incidence of cancer is increasing worldwide. How do we address this problem? What is the best way to deal with the problem of cancer nowadays? The best ways to deal with the problem of cancer is prevention. Prevention is always better than cure. Not to resort to habits like smoking and alcohol, to have healthy lifestyle habits, to maintain adequate body weight, not having excessive body weight, and resorting to healthy lifestyle habits. So this is how we prevent cancer. also by increasing awareness about the early detection of cancer. How do we detect cancer early in its curable stage? Unfortunately, most of the cancers of the internal organs of the body don't present at an early stage. By the time they produce some symptoms, they are already beyond the zone of cure and are either in a locally advanced or a metastatic stage of the disease. So how to detect cancer early? Cancer screening is the word which is used very often nowadays. Cancer screening is a method of testing normal people who do not have any symptoms, so that we pick up, if at all they have any problem, we can pick it up at an early stage. If we look at the commonest cancers in women in India, we notice that breast cancer and cancer cervix are the commonest cancers in women. So the way to detect breast cancer early is to do mammogram, regular mammogram for women more than 40 years of age. At least once in 2 years, it is suggested that they undergo mammogram screening of the breast. Suppose we scan 100 women who do not have any symptoms, maybe we will pick up 1 or 2 patients who are not aware that they have a cancer, and we can pick it up at a stage even before when the lump can be felt by the hand, and that is when it has a maximum chance of being cured. So the best ways to circumvent the problem of cancer is to prevent cancer and also to detect it early by resorting to methods like cancer screening. Thank you.